Good morning, everyone. Thank you so much for being here this morning. I want to start off by acknowledging my colleagues who are joining us today, including, of course, our Senate President Pro Tem, Tony Atkins, County Supervisor Nathan Fletcher, and, of course, San Diego City Council Member Dr. Jennifer Campbell, all of whom you'll hear from in just a moment. Between 2017 and 2018, San Diego experienced a severe outbreak of hepatitis A. 587 cases were reported, 402 people were hospitalized, and of course, 20 people died. This particular strain of hepatitis A, which originated here in San Diego, ultimately spread to other parts of our county, including Los Angeles, of our state, including Los Angeles, Orange, and Santa Cruz counties. In all, statewide, 704 cases were confirmed, 461 Californians were hospitalized, and ultimately 21 Californians died. In May of last year, after the end of the emergency, I asked the California State Auditor to review the city and county's response to the hepatitis A outbreak. The audit, which was published in December, found multiple problems with our local response. Specifically in the audit, the county failed to share location data with the city about where cases were primarily concentrated, and both the city and the county did not fully implement preventative measures such as hand washing stations, public restroom access, and street sanitation. According to the state auditor, these problems occurred due in part to the county health officer's decision not to issue directives to the city. The auditor also issued a series of recommendations for legislative actions for both state and local legislators to consider. I have chosen to accept the auditor's recommendations for state action, and today I'm announcing the introduction of Assembly Bill 262. AB 262 will require local health officers to promptly notify cities and counties in their jurisdiction about any communicable disease outbreaks and ensure that relevant information is made available to the appropriate public entities. The relevant information includes concentration of cases and the number of residents affected. In addition, AB 262 empowers local health officers to issue directives to other public entities in response to a communicable disease outbreak, meaning that local health officers must tell cities to take action in order to contain the spread of a communicable disease. Both of these legislative provisions will help ensure that local health officers respond more promptly to future communicable public health emergencies and ensure that the local public entity has the appropriate information to respond in a public health crisis. These are areas in which we know that city and county leaders could have done better, and what is clear is that lives could have been saved. With this bill, we seek to make sure that preventable outbreaks like this one never happen again. And with that, it's my pleasure to introduce the Senate President Pro Tem, our own state senator, Tony Atkins. Tony?
Well, thank you. Good morning, everybody, and let me just say thank you, Assemblymember Gloria, for your leadership on a really important public health issue. And it really is, as he said, truly a matter of life and death. The Assemblymember went through the numbers, the number of deaths, the number of cases, the number of hospitalizations. This was a wake-up call and a startling reminder of the link between a lot of issues: housing instability, homelessness, and of course public health. My colleagues and I were up at 4 o'clock this morning as part of the point in time count. And as we interviewed and talked to people, it was really clear the importance of the public health aspect of this. It could have been much worse. This was bad, but it could have been much worse. I will say the Assemblymember also talked about the audit that the state conducted by our Joint Legislative Audit Committee. I will remember the time, and as we saw the growing numbers, we were concerned, and we started to talk amongst ourselves in the legislature, because local control is very important. And those of us who've been city council members and have served in elected office for quite some time, you want to be in communication with your local governments, your local county. And in this case, we reached out a number of times and with growing concern watched as we were not informed and the proper steps were not taken. Assemblymember, I absolutely have to commend you for AB 262. I look forward to supporting this very practical, sound, common sense legislation to ensure that there is accountability, there is communication, and that we work hard to save lives. Thank you, Assemblymember.
Thank you, Senator. And I want to point out, I appreciate the Senator's support for the audit that brought us to today, that really informed the creation of this legislation, and appreciate her support for AB 262. Of course, this involved a county and city response. I'm grateful to have a county leader here with us this morning. Supervisor Nathan Fletcher, I think, will be extremely helpful in making sure not only this legislation gets passed, but that ultimately it's implemented. And so, Nathan, a few words.
Thank you. Thank you, Assemblymember Gloria and President Pro Tem Atkins, and of course, City Councilwoman Campbell. You know, what happened in San Diego is unacceptable. Public health is the highest charge and duty. Public health and safety is the highest charge and duty of county government. And as the audit laid clear, there were a number of things that should have been done differently. There were steps that should have been taken. There were actions that could have driven a better result. And what is incumbent upon us now is to make sure we never repeat the failures of the past, to make sure that we take decisive action to ensure public confidence and public health, and to make sure that the relevant agencies of government are taking seriously and to heart the recommendations that have been put forward. And I'm pleased to stand here in full support of Assembly Bill 262. The audit outlined a number of recommendations for things that have to change going forward, and I've committed that I will do everything possible to ensure that the County of San Diego adopts every single recommendation in the state audit, and this legislation is a central and key part of this. We cannot and we will not allow there to be a repeat of the mistakes of the past. This legislation gives the county more authority, but also holds us to a higher level of accountability. And I commend Assemblymember Gloria for his diligence in seeing this effort through. So often in the aftermath of a crisis or a tragedy, people move on to what's next. But what is incumbent upon us as elected leaders is to learn the lessons of the past and then to take action so that we can move forward and not repeat those. And so I stand in full support. I also will be asking the County Board of Supervisors to formally support and endorse this legislation at a future board meeting as well. So I appreciate Assemblymember Gloria's leadership in tracking this issue, pursuing this issue, and driving the parts of changes in state law we need to get in full compliance with the state audit. Thank you.
Thank you, Nathan, and thank you for your efforts to get the county's endorsement of this bill. Look forward to working with you in the months ahead to make sure this bill becomes, in fact, law. Again, this was a local issue of the city and county's response. I am incredibly grateful to have Councilmember Dr. Jennifer Campbell here, the doctor on call to fix City Hall. I think it's important to have, as we now know, to have public health expertise in elective office, and Dr. Jen is leading that charge. So, Dr. Jen, a few words.
Thank you. I'm going to grow. Good morning. I'm honored to be here to join Assemblymember Gloria, Senate President Atkins, and Supervisor Fletcher to discuss Assembly Bill 262. One of the main reasons I entered the campaign for City Council was because of the appalling lack of the proper handling by the city and county of the 2017 hepatitis A epidemic. As a doctor, I know that when an infectious disease such as hepatitis A doubles in caseload, it is time to call an emergency and immediately begin plans to stamp out the infection so as to protect the public health. Those in charge of our city and county should have acted in March of 2017 when there were 12 reported cases, and they waited 6 months till there were over 400 cases and 16 had already died. I was stunned by the lack of a substantial program to end this outbreak. The state auditor's report is clear. The response of the city and county was slow and inadequate. However, this is a path forward, and that's why I'm so glad to see real action is going to be taken by the state, thanks to Assemblymember Gloria and AB 262, that ensures that this type of thing doesn't happen again. This bill gives authority to county and city health officials to sound the alarm about potential health risks, not only to elected leaders, but to the public as well. It mandates that the city and county healthcare professionals have the authority to take and order corrective actions to protect the public health. This is the kind of common sense solution that we need, As with other state-mandated rules, state funds will be available to help put these actions into effect. AB 262 ensures that the mistakes of the hepatitis epidemic of 2017 in San Diego will not be repeated. This bill creates a safer, healthier San Diego moving forward. And I thank Assemblymember Gloria for doing this, and I thank the other officials for backing it. Thank you so much.
Thank you, Councilmember Campbell. So just in one moment. There we go. Someone to drop something. Just to wrap up, you know, the hepatitis A outbreak of 2017 and 2018 is a dark stain on our community's record. And as Supervisor Fletcher was saying, we could choose to just move on, or we can choose to fix it. And that's what we're doing. We helped to respond to the crisis in 2017 by declaring a state emergency, by providing hepatitis A vaccinations to try and stop the outbreak quickly. Once that was done, we called for an audit. The audit was done professionally. I want to thank Elaine Howe, our state auditor, for the very thorough report that she issued just a few weeks ago. And now we're taking those recommendations and we're putting them into legislation that I hope will be law by the end of the year. This is an aggressive approach to what needs to be done, which is, of course, taking care of the public health and ensuring that the most vulnerable in our community are not ignored. To my colleagues who are here today, all of whom have always spent their professional careers making sure that the voices who are often outside of government are actually heard, I appreciate your support and your partnership as we work to make AB 262 into law. And happy to take questions at this time or do one-on-ones for a few after we break. Yes? I'll let my colleagues start. Nathan, you want?
Well, thank you. Well, this is about the 10th year or longer I've done the point-in-time count, as have a number of my colleagues. And I would just say, when you look at some of the conditions, it's closely related to the need to make sure that you're protecting the public safety for the very individuals that we were talking to this morning. James, living on the street, HIV positive. A number of other women, Edwina, who was in a tarp, and you could smell, you know, kind of, you know, when you're in close quarters. You know, we do not take the request to do audits at the state lightly. That was the point I meant to make earlier. So the fact that we had to do this was, in fact, really quite a serious request to do. And it is linked. It is linked to things like housing instability and homelessness. And I think the stories that we hear remind us that it isn't just about Hep A, hepatitis A. There are other issues, and I know that my colleagues probably have things they would like to share.
I think when you go out and you do the count, it's not a count. You're interacting with people and you're talking to them and you're getting questions. And I think one of the problems that in society, it's just really easy to not see people. You know, it's easy to not see low-wage workers. It's easy to not see people who are unsheltered. And I think in society, a lot of times people just put on blinders and they just don't see it. And when you don't see them, you don't see the humanity that exists in all of them. And I think when you go out and you talk to people and you say, how long have you been homeless? What disability are you struggling with? Do you have a mental health issue? Do you have a substance abuse issue? You come to the realization that these are people just like the rest of us. You know, mental health injury and addiction and substance abuse can impact any of us. You know, and that could be our children or our brother or our parent. And, you know, I talked to a gentleman this morning, Mr. Stevenson, who was very candid. He said, I struggle with depression and I struggle with bipolar. And he said, and I'm addicted to meth. And he said, I hate it. But like, how do I get through the day? Well, this is an individual that if we had better mental health treatment, if we had better drug treatment, if we had more supportive housing, who doesn't want to be on the streets? You know, he wants to be a productive member of society. And so when you talk to him, it reveals, I think, the humanity of the issue. And I think that helps motivate us all to continue the fight to try and do more to address this issue. Because so often when we talk about this, it's like, well, it's an economic issue that impacts our businesses, and that's true, or it's this, or but it's a public health issue, and that's true. but this still is a humanity issue of how we treat one another. And I think I would encourage everyone to engage with folks. Just tell them good morning, look them in the eyes, ask them how they're doing. And I think a lot of folks would be surprised by what they hear.
My colleagues hit it on the head. I would just add, that I've been doing this for too long. It's always our annual reminder that, we do this once a year, but these are thousands of people who live this every single day. And, but for the grace of God, go any of us, right? These are average, normal people. I mean, they're folks who've just had, a couple bad breaks and they're on the streets, recognizing that many of them could be housed, but just simply can't afford to be housed in San Diego. So it certainly illuminates a lot of the work. It's a challenge to those of us in offices to do more, and we certainly intend to. But, we've been doing this work a long time. I'm looking forward to the day that we don't have to do it, because we've created an ecosystem where homelessness is rare. When it's experienced, it is brief, and that ultimately we're housing everyone. We should have a roof over every head of every San Diegan at a price they can afford. Any other questions, Jim?
Yeah, along those lines, and from what I understand with AB 262, that it would give more power to health officials to instruct cities and counties on what you need to do to take care of the problem. But the other way it might be heard, I think, by the general public is, it is an acceptance that we are planning on having thousands of people living on our streets in the foreseeable future, and we are going to now speed up the reporting process when outbreaks happen. What do you say to that?
I don't necessarily agree with that. Actually, the legislation is agnostic on the infectious disease. I think a lot of what we learned in the response to hepatitis A can be and will be used in future outbreaks that may be unrelated to homelessness. But I think what we found in this particular outbreak, and what the auditor found, was some egregious withholding of information. If communities of jurisdictions, in this case the cities of San Diego and El Cajon, were unaware that they were the hot spots of this activity, then how do they know to respond? How do they know to start doing power washing of sidewalks to provide sanitary conditions? They didn't, or they did not know for months and months, and in those months that passed, many people got sick and some died. And so the fact that we're going to make it explicit that you must share that information, if you have it, with your local cities, then we believe that will mean that lives will be saved and better outcomes will happen. The other piece is about the direction of work. Our public health officer, probably in furtherance of improving relations between her department and elsewhere, simply chose not to give direction to folks to actually start the response. But we want to change that. If you're the public health officer, as you heard Councilmember Campbell talking, she understands professionally what that means. It's lost on me. I don't understand that. I'm not a physician. But providing that information and that direction to do something about it will make it likely that again, the loss of life will be less. Certainly the number of people made sick will be less. And again, this is not just Hep A. This could be any number of illnesses that could affect any of us. And I think that's the final point. The reason why this started to get out of control was when this quit being a homelessness issue and members of the general population, folks who were sheltered, started getting sick. We don't want it to come to that, right? We want to stop it sooner, and that's what AB 262 is about. And I don't know if my colleagues have anything to add to that.
No, I think that's right. I mean, this could be, a few years ago, we had the H1N1 issue. And in the aftermath of that, there was a report that came out that made recommendations. And when I was in the Assembly, I authored legislation to implement those recommendations. And so I think any time, whether it's bird flu or swine flu or H1N1 or any potential public health crisis, you have to make sure that your systems are in place that are responsive and allow you to move swiftly, to break down barriers, to provide accountability. And so I think that under the leadership of Assemblymember Gloria, we're tackling public health issues in general. This happens to be the one that triggered the need for this, but I think it is much broader.
You mentioned H1N1. Was it withheld during that outbreak as well, the information that was needed to respond quickly to that particular problem?
No, the issue that we ran into in that case was in the event of having to do mass vaccinations, which it didn't come to that, but there was a period of time where we thought it might. You go back and look at the Spanish flu, which killed, a huge percentage of the population. When there was thinking that it might become a truly catastrophic, wild-spreading thing, we didn't have legally the authority to do mass vaccinations of children at schools. And under law, the only person who could give a vaccination at a school was a school nurse. So we did legislation to allow any medical doctor, pharmacist, nurse from anywhere, to come in and do that. It was a minor thing, but it was just something that people hadn't thought of, and that potential crisis highlighted the need for that, and so we made the appropriate changes, and this crisis highlighted the need for additional changes. And I appreciate Assemblymember Gloria following this, tracking this, demanding the audit, taking the recommendations, and making sure they're implemented.
think, well, if we'll, Dr. Jen, do you have something to say? Oh, sure.
I was in practice in Pittsburgh, Pennsylvania before I moved to San Diego 15 years ago. And we had a couple of outbreaks over the decades that I was in practice. And the public health officials there had the ability to immediately stamp it out. They had the legal authority, and they immediately did. None of it had to do with homelessness. It's fecal oral transmission for hepatitis A. So it could be from any source. So they called in the CDC right away, traced down the sources, followed the cases, and within a couple of dozen cases, it was stamped out in the city. So that's how any kind of outbreak like this should be handled. And, a virus doesn't care if you're homeless or in a house. It's going to attack you if it can. It doesn't care if you're male, female, gay, straight. It doesn't matter. So this outbreak sort of reminded me of the AIDS outbreak and how long it took to respond to that because of the prejudice against gay people. And this is absolutely, we must stop this prejudice. We must realize that we are all equal, and our fellow citizens who are on the streets must be housed. They must have wraparound services so they can get back on their feet and be healthy. Living outdoors is absolutely not good for your health, and the city and the county have plans. We're forming now a strategic plan that we hope to announce by the summer that will take care of this problem as best we can and get this problem solved. Thank you.
Doctor, can you expound on, because you said AIDS, it had a stigma around it, therefore it wasn't reported. Do you think that because the hepatitis A outbreak impacted the homeless, it too had its own stigma, and that is part of the reason it was not reported?
I don't know that it was part of the reason that it wasn't reported. I think the main problem is going to be solved by this bill. If you let the healthcare professionals who understand epidemics be in charge of stopping it, I think it'll be stopped. So, I think that it just helps all of us in society to realize that we are all one, we are all liable to get infections, public health matters hit all of us, and we all need to work together.
But mostly, I think the thing I appreciate, Assembly Member, is that this is about accountability, transparency, and that you have an obligation, a mandate, an obligation to make sure your partners in other government understand and know so that they can take action. So I think that is the point, the accountability, the transparency. Bottom line, regardless of what infection, what disease, what a stigma might be attached to it, bottom line, public health, accountability, transparency.
I want to wrap up, and mindful of my colleagues' time, and just wrap up by thanking Nathan, Tony, Jen for their comments. As Dr. Jen was saying, our public health professionals need to be allowed to do their job. I want to acknowledge SEIU Local 221, who we're hoping to earn their support. These are our public health workers, the people who are out in the field, really empowering them to be able to do their jobs. We know that they know what to do. They just need to have the legal authority, the direction to do so, as our Senate President Pro Tem was saying. And I would just sum up by saying, there is something to be said about our response to homeless people. Very commonly, we just don't want to look at it, as Nathan was saying. You fiddle with your car radio until the light changes because you just don't want to look at the panhandler. That same approach, I think, was on evidence in this hepatitis outbreak, and that can no longer be the case. To the extent that this bill corrects this problem and says very clearly that those folks who passed away did not die in vain. That's the intent of what we're doing here. I'm confident in our ability to be able to get this passed in the legislature, and will allow it to not just prevent future hepatitis A outbreaks, but outbreaks of any kind that threaten the public's health. I appreciate you all being here. We'll be available for one-on-ones for anyone who'd like them. Thank you very much.